LabTV. We are America's online video medical network, honoring doctors on the front lines of medicine, including hundreds from America's top hospitals and research universities, and hundreds more from the NIH.
Most important thing to me as a doctor is integrity.
I'm very much interested in improving the human condition.
At the heart and the center of everything is the patient.
LabTV, bringing you this video spotlight.
Well, the most important thing, I think, in the doctor-patient relationship is the relationship, right? A lot of people who say they don't like their doctors, many times if you ask them, it's because they feel as if their doctors aren't listening to them, right? And you really want somebody to listen to what you're saying because it's important to get that information across, and you really know your body the best. So you know if something's wrong, you know if you don't feel quite right, and you want somebody to hear what you're saying in order to be able to make the appropriate diagnosis. So the relationship, I think, is one of the most important things between the doctor and the patient. I like to show patients in the family the actual brain scans. And the reason why I like to do that is because I know when I'm talking about it, what I'm thinking about and what I saw, but I don't know what they're thinking about in their head. So I actually like them to see the brain and that it's a great looking brain, but that there's a problem and that we need to do something about it. So I think the visual stimulus allows a better interaction as well as a better understanding, not only with the patient, but with their family. I definitely want them to realize that they're in the right place, and I definitely want them to realize what the problem is and how we're going to solve it. I think hope is very important, certainly, but I also think being realistic about what can happen and what someone can do is important as well. So I think, again, partnering with the patient, having them understand what the problem is, the complexity of the problem, and what are the options for treatment. Because again, I feel as someone feels part of the plan, they have some control of what's going on, and hopefully things go well. But you know, the unfortunate thing in life is that not everything goes well. But if you understand the steps that go along with it, I think it goes a long way in terms of helping not only the patient, but the family. I like to treat patients the way that if I had that problem, I would be treated, or I would want to be treated. So I think that it's just my approach that I try to make patients as comfortable as possible when they come in, and I give 100% with each patient. So I think that's what sets me apart.